everybody. Well, it's actually happening. I have taken the plunge and I am recording my very first podcast. I've been teasing and talking about it since, I guess, the spring, but I guess my hatred of hearing my own voice recorded has caused me to procrastinate just a little bit. But here I am, and the reason that I have decided to launch this podcast is so that I can have a forum to get some medical information out there that in large part is going to be centered around plastic surgery concerns and issues, but just to get some good medical information out there and hopefully to dispel some of the misinformation that floats out there on social media. In particular, today, for my very first podcast, I want to focus on breast implants. Breast implants are a hot topic in terms of their safety and efficacy. Over the last few years, they've been in the news quite a bit. And as recently as about 10 days ago, the FDA issued yet another alert with regards to breast implants. And this time, it encompassed all kinds of implants, meaning those filled with saline, those filled with silicone gel, and those with a smooth as well as a textured outer wall. I know that may sound like a lot of information there, but I'm going to go through and give you a little history of breast implants and a little chemistry lesson, so to speak, and go through the data that we have regarding the safety and efficacy of breast implants and what the current trends are. So just for history, breast implants have been around for quite a while. And in fact, if you have not seen it, an interesting movie to watch is a movie called Breast Men. And David Schwimmer was actually in the movie. He played Dr. Cronin, who was one of the pioneers of breast implants. But it's a really interesting show. But it gives you some background as to how old these breast implants are. And breast implants have historically been made out of a solid silicone outer shell, and silicone is a polymer. And one of the big differences between various implants that are out there is whether that solid silicone shell is filled with saline or salt water or silicone gel. So just to go back a second, and just for clarification, every breast implant that's out there in the market right now is made out of solid silicone. So no matter how you slice it, no pun intended, there's no way not to have silicone in your body if you are having a breast implant placed. So the differences between the solid silicone that is used to make up the wall of implants that are filled with saline or salt water, as well as the silicone gel, have to do with the amount of cross-linking in that polymer chain. So the more solid forms have more cross-linking than the gelatinous forms. And going back to the early days of silicone breast implants, the outer silicone shell was more thin, and the gel was very gelatinous, almost liquid-like. And they were popular and liked by the doctors that used them because they were felt to be very soft or thought to be very soft. They did feel soft, and that softness of feel was thought to be very natural feeling. So that's what was used. And again, just getting back to sort of the history lesson of breast implants, I'm sure a lot of you remember all of the media attention in the early 90s, 1992 to be exact, when the FDA banned silicone gel-filled implants. So the implants that were banned at that time were made by Dow, and a huge class action lawsuit was filed in response to this FDA ban. And those implants were, again, more liquid-like in terms of the gelatinous inner content of that solid silicone shell. And they were prone to rupturing. And at that time, women were coming forth with complaints of what we call back then chronic fatigue and headaches and just what we call constitutional symptoms or complaints, and it was thought that the ruptured implants had something to do with it. They also thought that the ruptured implants had something to do with autoimmune diseases. So there was a halt to the sale of gel-filled implants, but the FDA at that time allowed and continued the use of the saline-filled implants, which again still had an outer solid silicone shell. So throughout the 90s and into the early 2000s, the majority of implants being placed in the United States were of the saline variety. Women were very scared. That was at the time where I was doing my plastic surgery training and early in my practice. And women would commonly come in and say, I want breast implants, but I'm scared. I'm scared about the safety of them. And not only was saline the only ones readily available, but the women wouldn't touch a silicone implant anyway. That being said, there were scenarios where you could get a silicone gel-filled implant during that ban time frame, and the ban lasted from 1992 to 2006. And during that period of time, you could get a silicone gel-filled implant if a patient was enrolled through his brain, though. A patient, through her surgeon, could be enrolled in what was called the adjunct study. And those patients who were candidates for the adjunct study could get gel-filled implants. And that study most principally allowed breast cancer survivors to have reconstruction with silicone implants, because even during the ban, surgeons still felt strongly that the gel implants were more natural feeling, which was especially important in a woman who had had a mastectomy. There were some carve-outs and caveats, which is not shocking when you're dealing with the government. But if you were having a lift done at the same time as having breast implants, that would be a reason why you may have been a candidate for getting gel implants through the adjunct study, or if you had other complications related to saline-filled implants. And during the time frame of the adjunct study, the FDA collected a bunch of data and information and deemed in 2006 that the gel-filled implants were indeed felt to be safe. So they were re-released in the market, and in 2006, there was still a lot of trepidation about getting a gel-filled implants. At least that's what I saw in my own practice. So even in that period of 2006, 7, and 8, a lot of patients were still requesting saline-filled implants, including my breast cancer patients, believe it or not. But over time, the gel-filled implants have gained in popularity. And in the earlier time frame of the sort of re-entry of gel implants, I didn't hear quite as much about silicone sickness and all of the complaints about the autoimmune diseases and whatnot. It was sort of like it had quieted down a little bit in that time period over the ban. That being said, there were women that still had fears about the implants, but you weren't hearing quite as much about the silicone sickness type phenomena. So I definitely saw an increase in my own practice, and it was substantiated by other surgeons' practices as well, that the number of gel implants being placed were increasing and starting to take over the placement of saline-filled implants. So just to also give you a little information, in addition to the adjunct study where a lot of data was recorded, there were also 2 studies, one done out of Mayo and one out of Harvard, that looked at nurses with and without breast implants to try to decipher the role of breast implants in the development of autoimmune diseases. And again, in taking the totality of all this information, it led the FDA to allow the gel-filled implants to re-enter the U.S. market in 2006. It's also worth noting that other countries around the world did not ban gel-filled implants, and they continued to use them. It was more of a U.S. phenomena of banning the gel-filled implants. And I would even hear stories of some surgeons that would get gel-filled implants from countries like France for their patients. Again, not something that was probably allowed or accepted by the powers that be in the medical community, but I think stuff like that did occur. But anyway, so fast forward from 2006 when the gel implants got re-released to where we are in the 2020s. And as I mentioned, the gel implants have gained in popularity, and the gels that did get re-released, the inner gel was had a higher viscosity or was thicker than the earlier gels that were more liquid-like. And the cohesiveness, that's a term that you hear a lot with breast implants, or cohesivity of a breast implant, speaks to how much those polymer chains sort of stick together. And nobody wants a totally solid silicone chunk in them to be their breast implant. You want some softness to it. You want it to feel natural. But again, the more gelatinous or liquid-like the gel is, the more concerns there are that that gel, if a ruptured implant were to occur, could leach into the tissues. So cohesiveness is something that has been a popular topic in plastic surgery, and the company that I use most frequently, which is Allergan, and again, I'm not a paid spokesperson of Allergan, so I have no skin in this fight, but they actually have 3 different varieties of cohesivity with regards to their gel-filled implants. They have one that's very soft, one that's sort of medium, and one that is much firmer. And many of you may have heard the term gummy bear implant, but the gummy bear just speaks to a more cohesive gel. So the thought is that these more cohesive gels would help reduce women's concerns about the gel spreading through their body if a rupture had happened. And a rupture happens when that outer solid silicone wall breaks down, and when that happens, the inner contents of the implant leak out. And with the saline-filled implant, there's no mystery as to whether there's a rupture or not, because the body will just absorb the salt water that was placed in the implant at the time of surgery. Whereas with the gel-filled implant, it's a little bit more confusing because the gel isn't absorbed by the body. So in many instances, those ruptures are more silent. So that is, and yet again, another reason for some concern over the gel-filled implants, because it's not as easy to know whether you've got a rupture or not. So, but the rupture rates are felt to be acceptable with the gel-filled implants and are quite low, just like the deflation rates with saline implants are pretty low. So with regards to the data that we have had, it was felt that the implants were safe, and the silicone implants were definitely gaining in popularity. But then over the last few years, we're hearing more about a phenomena called breast implant associated large cell lymphoma. And it's something that we first started hearing about approximately 10 years ago. And there have been very isolated cases of women that many years after having had breast implants, actually what I meant to say is that women, after having had implants years prior, were experiencing a sort of new onset of rapid swelling and redness of the breast. And on further testing, a really curious phenomenon was found, and the fluid around the breast and the implant capsules revealed what was called breast implant associated large cell lymphoma. So lymphoma is not breast cancer. Lymphoma is different, but it's just very odd and curious that it was showing up in the capsules and some fluid that developed around previously placed breast implants. And when we started hearing these isolated case reports that were very rare and infrequent, and they still are, frankly, the common denominator appeared to be a characteristic of that outer silicone shell of the breast implant. So this breast implant associated large cell lymphoma is seen not just in implants filled with silicone gel, but also those filled with saline. And again, the common denominator had to do with the wall, interestingly enough. And this outer wall was textured. And you'd say, well, why would there be a texturing on the outer wall? Well, one of the reasons that a surgeon may choose to use a textured implant is if he or she believed that that texturing or roughening of the outer wall, as opposed to the other variety, which is smooth, may help prevent a contracture or excessive scar tissue formation from forming around the breast implant. So some surgeons felt strongly that that texturing was important to prevent the phenomenon of contracture, which is one of the complications we all dread as plastic surgeons. Nobody wants a breast that feels rock hard and looks deformed because of too much scar tissue around it. So texturing was thought to be a way to possibly mitigate or reduce the risk of a contracture. And texturing is also a property that was really popular in other countries around the world. So a lot of these cases of the breast implant associated lymphoma were abroad. They weren't even in the United States. But again, when we started to hear these cases, it was very rare. There really wasn't much spoken about on the press up until a couple years ago. And as I just mentioned a few minutes ago, during this time frame, silicone gel filled implants were becoming more and more popular, and we weren't hearing as much chatter about silicone sickness or the link between gel implants and autoimmune diseases and sort of the constitutional symptoms that people were talking about previously. But starting a couple years ago, there was more attention in the national news media about the link between textured implants and this large cell lymphoma. And the FDA actually came out and banned textured implants a couple years ago. So we're now in a situation where, in the United States at least, we're only using smooth, round implants, whether they're filled with saline or the silicone gel. So just to refresh, this new phenomenon of which we've, had only isolated cases, even to date worldwide, the number of worldwide cases remains relatively low. The number that sticks at the top of my head, I think it was like 700 some cases that were reported worldwide to date in 2019. I don't know what it's up to now, but when you think about the millions and millions and millions of women that have breast implants, that number's low. But that being said, there have been some fatalities linked to this breast implant associated large cell lymphoma, and it's a scary thought to think that that these devices might be linked to a cancer. But again, that is a lymphoma kind of cancer, and distinct from, as far as we know, the symptomatology that women reported with regards to the gel implants, both back in the late 80s and early 90s, as well as more recently. But as there was more and more chatter about the breast implant associated lymphoma, I definitely feel personally, and I think it would be backed up by my colleagues, that we're hearing more and more yet again about breast implant illness or silicone implant illness. And the question is really, what is this implant illness? Is it real? And if so, what's it all about and what causes it? So unfortunately, we don't really know. And I am certainly not going to sit here and say that a woman that comes in and had been feeling great and then have had breast implants placed, and started developing these symptoms of feeling sick, and then subsequently had them removed and her symptoms went away. I'm not going to say that it wasn't related to the breast implants. I just can't give a great medical explanation for it. In my own sort of limited, not, I wouldn't say limited. Actually, what I meant to say, in my own way of looking at things, and I've given it a good bit of thought too, is wondering whether the etiology for both the silicone sickness and possibly the breast implant associated lymphoma might go back to a biofilm or a bacterial colonization of the outer wall of the implant. And what strikes me as interesting is that we know that bacteria can cause inflammation and make somebody feel sick. But maybe, and maybe this is too simplistic a way of looking at things, but maybe the constant colonization is what's giving people the feelings of the general malaise or the autoimmune-like symptomatology. And maybe somebody's immune system, if they're susceptible to it, after years and years of chronically fighting off this biofilm, maybe their immune system breaks down and leads to a lymphoma, which is a cancer more of the immune system. So again, maybe that's just my too simplistic way of looking at it, but it would explain to me the phenomena. But maybe the two are not linked. Maybe implant illness and the breast implant associated lymphoma aren't connected at all. And they're two different things. But what is happening is that the social media sites and the press are sort of confusing the issue and making it seem like they are all one. And as a result, recommendations on how to treat the conditions are getting merged together, and some not so good recommendations and information is being put out there on the internet. For instance, if you have cancer, oftentimes we treat a cancer with surgical excision. There are times when we can't surgically remove a tumor, such as certain kinds of brain tumors that are in tricky locations, but a lot of cancers are treated surgically. So when you're dealing with breast implant associated lymphoma, one of the methods of treatment is to surgically remove the capsule, and to do so in an in-block format. So you're in an in-block method. So what you're doing is removing the entire capsule and tissue around it to help ensure negative margins and that you've, so to speak, gotten all of the cancer out. So that's what you do when you're dealing with cancer. Now, implant illness, that again, we don't have a great understanding to what it is, what causes it, but what we do know, it's not cancer. But what we're seeing on the internet are chat rooms and chat sites saying and recommending that if you've got implant illness, that you should have in-block resections. Well, the problem is if you do a radical excision of tissue and take out the implants, you could be facing some serious deformity issues. In addition to just the shock of having lived many years in many instances with full breast because of your implants, not only are you going to not having breast implants and having that volume there, but additional deformity from a more radical excision of tissue, which may not be warranted if the issue is breast implant illness as opposed to the breast implant associated large cell lymphoma, which again is cancer. So I'm spending time trying to explain this to patients who come in with requests to have in-block resections because they have implant illness or are afraid that they do because they've been suffering from chronic headaches or unexplained rashes or maybe some hair loss, of which there might be other medical conditions such as thyroid disease or other stressors in somebody's life that might be contributing to the symptomatology. I'm not trying to say that it may not be the implants, but I certainly don't want to guarantee that an implant removal is going to remove all symptoms, and certainly don't want to cause excessive deformity for something that's not cancer. And again, I mean, any implant removal for such conditions as silicone sickness or implant illness need to be really carefully thought out and considered, because there can be quite a shock and a change from having breasts one day and not the other for women that are very small breasted and very petite. Now, some women are coming to me, and since they had their original implants placed, they've gained quite a bit of breast volume, and they may not even care to have breast implants anymore. So for those patients, the decision making might be much easier. And in those cases, where again, there's no concern of cancer or breast implant associated lymphoma, we typically remove the capsule when indicated, meaning if there's anything suspicious with it, we remove the capsule. But if it's benign appearing and the patient's really not having much symptomatology, but just wants the implants out just for peace of mind, we may leave a little bit of capsule behind. So just to, again, to minimize morbidity. And then there are instances where we may want to remove the entire capsule, but in order to do so would involve removing capsule that may be very densely adherent to the rib cage, and it really may not be surgically possible to remove it without causing such phenomena as a collapsed lung. So sometimes we have to leave a little portion of it behind and treat it by maneuvers such as cauterizing the capsule, because it's just not surgically possible to remove it all. And I just want to pause for a second. I know I'm giving you guys a ton of information here. So hopefully I'm answering some questions, but hopefully I'm not confusing you too much at the same time. But it is just a lot of information to decipher. But just in summary, there are concerns about breast implant associated lymphoma, most likely and most commonly related to textured implants. There's a concern about silicone sickness with silicone gel-filled implants. And just for clarification, the lymphoma is in both saline and silicone implants, but the common denominator is the textured wall. But the silicone sickness is seen more in gel-filled implants, though ironically, as I explained at the very outset of the podcast, all implants are made out of solid silicone. So bringing things more up to date, the ban on textured implants happened a couple years ago, and then this time last year, the FDA came forward with requirements on surgeons and implant manufacturers for us to provide detailed consent forms to patients that are wanting to undergo placement of breast implants, both saline filled and silicone filled. And mind you, textured implants are no longer on the market. And when I'm doing a consultation with somebody regarding breast implants, we decide whether we're going with saline filled or silicone filled. And then depending on features that are unique to a patient, we decide what is going to be the best cohesivity of the implant. Somebody that's super, super thin, we might go with a more cohesive implant to minimize such complications as rippling, where you can see sort of ridging of the implant. And in another patient, we may go with a softer form implant. And the reason that we truly don't have gummy bear implants anymore, which were the most cohesive implants, but in a teardrop shaped form, is that teardrop implant was textured. And I told you we have banned textured implants. So you can still get a gummy bear implant, so to speak, in terms of a more cohesive implant, but it's encased with a smooth silicone outer shell now, as opposed to a teardrop shaped textured implant. So the FDA last year came forth with these very extensive consent forms as part of a requirement for breast implants. And in it were some new updated recommendations on surveillance of breast implants, especially silicone implants, to assess whether there may be silent ruptures going on. And as I mentioned earlier, that's one of the things that's tricky about a silicone-filled implant, is that a rupture may be silent. I mean, if the gel is somewhat formed and cohesive, if the outer wall breaks down and there's a rupture, but the gel doesn't really go anywhere, the breast may still feel soft and the woman may have no idea that the implants are ruptured. So the FDA is recommending an ultrasound every 2 years to assess the implant situation. But then Thursday, a week ago, the FDA came out with a new alert saying that both saline and silicone-filled implants, both textured and smooth, have been linked in a very small number of cases to not just lymphoma, but a kind of lymphoma different than the breast implant-associated lymphoma, but also squamous cell cancer, which is a typical cell type that we see in very common skin cancers, which are oh so prevalent here in the Low Country with all the sun exposure. So we don't know what to make of this new alert. It's a very small number of cases and very little data is being provided. But the FDA and the American Society of Plastic Surgeons is still coming up with is not coming up with, but is compiling data and collecting data so that recommendations can be put forth with regards to breast implant placement. So that's sort of a recap of where we are. You know, in terms of deciding what a patient should do with regards to the implants, I think the most important first step is to come in and have a discussion with me or another plastic surgeon to figure out whether, first and foremost, make sure that you don't have any symptoms associated with the breast implant associated lymphoma. But, you know, if you've got concerns that you've had unexplained headaches or rashes or whatnot, and you think it might be related to their but also to the implants, I think there needs to be a very thoughtful discussion about what proceeding with explantation actually is going to look like, both not just in terms of the cosmetic aspect, but what are realistic expectations in terms of the resolution of your symptomatology. I want to go back for a second to the comment I made about my simplistic way of looking at things as maybe being related to an infection. One thing I can tell you is that I have truly seen mold in implants when I have removed old saline implants that were placed 30 years ago. Additionally, I had a case a couple weeks ago where we removed the implants and the capsules, but again, not a radical in-block resection, but I did remove the capsules on a woman that's had a lot of inexplicable systemic changes in her skin and her hair. And sure enough, after awaiting prolonged additional culture results, a bacteria grew in the capsule. So maybe that is the reason for her symptoms, or maybe not. Time will tell if her symptoms are resolved. For her sake, I hope so. But, you know, I can't make those guarantees prior to removing the implants. And it can be quite a shock to go from having implants to not. And just reiterating that over and over again and emphasizing it, because I've seen women come in with serious emotional distress after they've made that change. And while they thought they were doing it for the betterment of their overall health, the negative impact of the implant removal on their psyche is not insignificant. So I just want to emphasize that. And I just want to end by saying that, again, I'm here, my staff is here to answer any questions that you've got. But there are some great options that are out there that we're seeing for women that want to maximize the appearance of their breast and are done with their implants, whether they just feel that they don't need them anymore or don't want them, or they just have lingering concerns even if they don't have any symptoms. So we're doing a lot of implant removals, but combining it with breast lift surgery and sometimes even doing fat grafting to the breast to replace some of the volume that's lost. And there are pros and cons to fat grafting, and obviously breast lifting does involve scars, but We have seen some great results and have had some really happy patients. So that is something to consider as well. But, my foremost concern is to make sure that if you've got anything that you may suspect to be the breast implant associated lymphoma, which again typically responds as a new onset of swelling or redness of a breast, maybe for implants placed eons ago, but maybe implants placed more recently, that deserves immediate medical attention. And also to remind everybody to be getting their every 2-year ultrasounds if you're not already getting your yearly mammograms with or without ultrasounds, just to help assess the integrity of those implants. But anyway, this is my first foray into the podcast thing. I hope I didn't do too horrific a job. And please don't hesitate to call if you've got any questions. Until next time, see you later.